My name's Mary Bartlett. I'm a family nurse practitioner. I'm also an HIV specialist. I work at the Fairhaven Community Health Center in New Haven, Connecticut, and I'm also the medical director for Haven Student-Run Free Clinic. I came to nursing through a rather circuitous route. After working construction for about 10 years or so, realized that I still had the bug in me that I really wanted to be taking care of patients. And so got a job at a community health center. So I've been in community health center work for almost 20 years. I've worked in community health centers. This is what drives me. This is my passion. This is what, makes me get up in the morning and want to do what I do. It's just incredibly rewarding personally, and you really kind of feel like you're making an impact in some small way on some of the issues of health disparity and access to care. Rebellious nursing to me means a lot of different things. There are over 2 million nurses, and yet it seems that we don't wield the amount of political power that we could or should. In particular, I think about it in the field of the patient-centered medical home and the role of nurse practitioners. We see time and time again that the AMA and various other medical organizations that say that they believe that it should be doctors and primary care doctors who are the leaders and on the forefront of the patient-centered medical home. And I think that, in fact, primary care is something that nurse practitioners do really well, and that we should have a greater voice, and we should have equitable financial reimbursement as far as taking care of patients in a patient-centered medical home. It's one of the most important things, is to realize that we all do bring different things to the table of primary care, and that we all should have a voice. And I think so often it's the nursing voice that is not always heard. It's not always the voice that's on the forefront. And I think that there's a lot that we can do as rebellious nurses to change that. I've been out since I think I was in high school. And I think it's one of the things that perhaps is not as spoken about in nursing, and that I don't think there are as many people of color, people of different sexual orientations, and people of different gender identities. I think that's one of the things that nursing has, we always think of a particular person in the little white cap, and I think that the image of nursing has been slow to change as to who are the nurses that are out there. And I think especially when you look at our GEPIN program, and there's so much variety of the people that come there with their different backgrounds and their different education and that kind of stuff, and so I feel that that we can broaden our image of who we are. There are many people that believe and read the mission statement of the Rebellious Nurses and realize that this agenda is very inclusive, and that the whole point of it is that it's about questioning authority. It's about understanding who we are and what we do and why we want to see change happen. One of the most powerful things that could come from this conference is the ability to network and the ability to be strengthened and fortified and be able to feel that, there are other like-minded people who really believe in what we're doing and how we're doing it. Go Rebellious Nursing Conference, please come.